So Doctors Without Borders is urging government to make the 2 new drugs recommended to treat COVID-19 easily accessible. Just last week, the WHO said that these drugs improve survival and reduce the need for ventilation. The WHO says that the extent to which these medicines will save lives depends on how widely available and affordable they'll be. But Doctors Without Borders also says that the life-saving treatments are currently in short supply in middle to low-income countries. MSF's Access Campaign Officer is Candice Sehoma, who joins us now via our video link. For more on what we know about these drugs, Candice, thanks for making time. It's great to have you on the program. Let's begin by just identifying what these drugs are and why it is that they seemingly aren't accessible to all countries.
Yes, so thank you so much for having me. As you had mentioned that the WHO recommended Baricitinib for the treatment of people with severe and critical COVID-19 symptoms. And what we are currently seeing is that, we are facing yet another challenge with accessing these COVID-19 or life-saving medicine due to patents.
Sure. And, again, it almost feels like deja vu, isn't it? We've gone through typically what this argument entails when we're discussing vaccine inequality or inequity across the world.
Yes, it feels like, it's just a cycle, that's an unending cycle. And I'm not even sure what has to happen for our governments, for, pharmaceuticals, for these global institutions to really take this issue around patents seriously. And I think what we're seeing with the issue around Baricitinib, which is this recently recommended COVID-19 treatment, is that it has been patented in countries like South Africa, Brazil, the US, which essentially makes the medicine, expensive. In the US, that drug costs about $2,000 US. That's for a treatment course, for a 14-day course, versus in Bangladesh or in India, which costs about $6 basically. So it's this huge disparity, which is nearly about 400 times less in the US. So and I think due to this, the reason why we have this is due to the patents that create these disparities, where countries like Bangladesh, who can create these generics of the medicine, actually it costs so much lesser than countries like South Africa and the US, where the medicine is patented.
Yeah. Can we speak a bit more about the unique benefits that come with these drugs in particular? I see one of them you can even administer orally. I mean, that for one is a great advantage.
Yeah, it's oral treatment that can be, and you only have to drink it like once a day for 14 days. So even the time period in which you have to take it is actually quite, reduced and more tolerable. But yeah, I think as mentioned, it's something that can reduce it's mainly recommended for critically ill, hospitalized patients, and can, use it as an alternative to other drugs who also are very expensive. Things like Gilead's, sorry, I just forgot the name, but in terms of the alternative use of this drug, it's much more. In other settings, of course, it's much more less expensive, and as you say, it's an oral drug that can be tolerable for patients.
Yeah. How urgent do you reckon this particular issue is? And I'm asking this in the context where there's been interesting outcomes, at least if the Omicron variant is anything to go by. We're seeing less severe illness. It is highly infectious, but people aren't dying as what we've seen in previous waves. Does that context give us, dare I say, a bit more time to sort this out?
I think it's quite urgent. I think, we are still in the context of a pandemic where people are still dying, irrespective of the fact that there might be reduced levels of deaths. But, those numbers that one person is still, a death that can be prevented in such medicine is, very critical in saving people's lives. So I think it is an urgent matter that should be resolved, but also I think kind of emphasizes the need for even our South African government to push in terms of, rectifying our patent laws. The fact that we can't get this medicine in a in an affordable rate is because of the current patent system that ensures that pharmaceuticals like Eli Lilly are able to price exorbitant, prices for such medicine. So I think what is urgently needed at the moment is for the South African government to change and accelerate the reform of our patent laws to ensure that we can have generic medicine from Bangladesh, from countries like India, into the market that are less expensive.
MSF's Access Campaign Manager is Candice Sehoma. Candice, once again, thanks very much indeed for your time. It's a story that we'll keep watching for you as it continues to develop, especially when you consider what is at stake as we continue fighting the COVID-19 pandemic.